What we're going to talk about now are some more advanced situations you may encounter when treating your patients with Powerprox 6-month braces. High canines. We want to avoid unwanted adjacent tooth movement when we're treating patients with high canines. I had a doctor send me this picture, and she said, "Hey, Rick, after a couple of months, this patient came back with an open bite. I'm going to show you how you can avoid this from happening." You can get unwanted adjacent tooth movements if you approach those high canines in an improper way. And this can cause some serious lateral bowing as well if you go after these high canines in an inappropriate way. I'm going to show you the right way to go after these high canines so it's very quick, easy, and predictable treatment for you and your patients. This is the wrong way to go after a high canine. Do not go after a high canine with continuous nickel titanium archwire. Okay, do not go after these teeth with continuous nickel titanium archwire. Because what's going to happen as that canine extrudes, comes down, the adjacent teeth, the lateral and first bicuspid, can intrude, tip, and rotate. The canine is a very strong tooth, has a lot of anchorage power. Okay? In canine versus lateral and first premolar, canine usually wins, especially if there's crowding around that and there's not free space for that tooth to erupt into place. And that's exactly what happened in this situation. We have a doctor who went after his canine with continuous nickel titanium archwire, and at the next visit, the lateral and first premolar had intruded, tipped, and rotated. Again, this can get really bad when you're going after these high canines inappropriately with continuous nickel titanium archwire. This is a more appropriate way to go after these high canines. You want to use a wire that bypasses the canine itself and then go after the canine from the archwire to the tooth itself. If you use an elastic to go from the canine down to the archwire without bending that archwire up directly to the canine, you're going to get a much more predictable tooth movement. It'll actually be faster because you're going to avoid those unwanted side effects of the adjacent teeth. It's going to help bring that tooth more straight down without getting tipping, intrusion, and rotation of the adjacent teeth. So what you want to do with these high canines is you want to tie the canine into the archwire, not with continuous nickel titanium archwire. Tie it into the archwire. I like to use a knotted power chain, the same kind of knotted power chain we use when we're placing rotation ties. Then when it's down a little bit, we can place a piggyback archwire. Another great trick is to use what I call the big step bend with the piggyback. Now it's best to use open coil spring with these techniques, open coil spring between the lateral and first premolar, so you can maintain space for the canine to come in, and if you're using a power chain, it allows you to keep that chain from sliding around on the archwire, and also if you need to pull that tooth mesially or distally, you can change the direction that it's pulling. So to place a knotted power chain, take about a 9-unit power chain, close the tip of your math out, and then shove that closed tip through that last loop on the power chain. Then you're going to slide the free end underneath the archwire. Then open that math out tip just slightly and grab that last loop on the free end. Then pull to make a knot. Now you have knotted the power chain onto the archwire. Now just take that power chain and stretch it on up to the canine, put it on, and cut off any extra units that you may have. This is going to be a much safer way for you to bring that canine down. And here's a clinical case where we did just that. Now you can see in this case we have open coil spring. We have a wire that's bypassing the canine, open coil spring to maintain the space for the canine. Now remember, one of the things I said about the open coil spring, besides maintaining space, you can use it to change the direction that power chain, that knotted power chain, is pulling. In this case we didn't want to pull it just straight down, but we wanted to also pull it towards the distal. so we have the knot anchored more towards the distal, and the open coil spring can help keep it there. So we're killing two birds with one stone, bringing that canine down and also moving it distally. Now, once it's come down a little bit from what you did with your knotted power chain, I like to use a piggyback archwire. I like to have a heavier archwire in the bracket slots bypassing the canine. You know, at least an 018 nickel titanium, even an 018 steel is a great wire for this. And then I typically use just an 014 nickel titanium as my piggyback archwire. Now, there's enough room in the bracket slots to fit both archwires, typically not in the molar tubes, but in the bracket slots. So if I'm trying to bring down a high canine, my piggyback usually extends from second premolar, usually to contralateral central. As long as you're at least 2 teeth on either side, maybe 3 teeth on the anterior, you have plenty of anchorage to help bring that canine down very safely and efficiently. And here's a clinical example. You can see we have our main base wire bypassing the canine, and then our second piggyback, light nickel titanium, like an 014 is perfect, arch wire going through the premolars, up to that high canine, and then over to at least the central or contralateral central. And that's going to help bring that canine down very quickly. And because we're not using a continuous wire, we're not going to have a lot of unwanted side effects on those adjacent teeth, the lateral and first bicuspid. And you can see what happened in just one visit. Okay, so it's a very quick way to do it and very safe way to do it as well. Now, if you have a situation where the piggyback, once the canine's coming down, the canine itself is going to hit the main wire, what you can do is place what I call a big step bend wire with the piggyback. In the main arch wire, you place a little step down bend to give a little extra window for that canine to come down into, so the cusp tip will not hit that main arch wire. Now, in order to make that step bend, you have to be in a steel arch wire. So an 018 steel is perfect for that. And again, your nickel titanium can be, you know, even just an 014 works very well. And here's a clinical example of where we have done that. We've just made that big step bend and placed our nickel titanium arch wire to get that canine down the rest of the way. It was still a touch too high to go with continuous arch wire, so we made that big step bend and then brought that tooth down. You don't have to use this in every high canine case, this big step bend wire, but it's a nice trick to have when, you know, that canine's still a little bit too high. You don't necessarily want to go with continuous, but the piggyback, you know, you're hitting that, the canine cusp tip is hitting that main arch wire, rendering the piggyback ineffective. And here's just a video that's going to show the big step bend in action. Now I like to use the ribbon arch plier, grab the wire in the place you want the bend to be, and use your thumb to bend as close to 90 degrees as you can. Then you only need this generally to be a few millimeters, just enough for that cusp tip not to collide with the wire. Place it again, and then bend another 90-degree bend with your thumb against the plier beak. Okay, so you have a nice step up, big step bend, okay? You know, just a handful of millimeters, whatever you need it to be. Then you only need, you know, enough space for the canine. It's got to fit between, obviously, the lateral and the first bicuspid bracket, so it has to be shorter than that inner bracket distance. Make your next bend. Then one last bend to make sure now you have your nice big step bend placed. And you can place open coil spring over that too to maintain that space, while you then have your piggyback arch wire going directly to the canine. So this allows that wire to still bypass the canine, but there's that little window, that big step bend creates that little window, so as the piggyback's bringing it down, it will not get in the way. That main arch wire is not going to collide with the cuspid, getting in the way of that final movement. Great little trick. Now, what if you have what I call a not-so-high canine? A canine that's not quite high enough for a knotted power chain or a piggyback archwire. Here's a neat little trick in those situations. It's what I call the Canine Sling. The canine's still too high for me to want to go up after it with continuous archwire. But if I put a knotted power chain on it, you're only going to have maybe one loop of chain and nothing's really going to happen. Now you could do the big step bend with the piggyback. That would also work. But here's a really quick and easy way to do it, what I call the Canine Sling. It's just a neat little power chain trick. Take about a 4-unit power chain and place it on that canine bracket before you have an archwire going anywhere near it. Okay? Then what you do is you tie in the archwire everywhere else, and then you're going to just loop that power chain over those remaining units. So you basically have a little sling that the wire sets in, and you can see that the wire is going to be incisal to the bracket. So the nickel titanium archwire will not, be reaching way up to get that canine. It's going to be a bit lower, so that's going to help prevent unwanted side effects, unwanted movement on those adjacent teeth while still bringing that canine down.